I'm Sean Park, urologist practicing in Seoul, South Korea. There was a conference about the penile implant for the first time in Korean history. I was honored to invite Dr. Daniel Osmanov from the Kiel University to join us. South Korea is the second biggest market in terms of penile implant surgery. Biggest market in the world is US, but the difference between the US and South Korea is that penile implant surgery is covered by the insurance in US, but not in South Korea. If we consider insurance coverage, South Korea may be the biggest market in the world in terms of insurance uncovered penile implant surgeries. For the past almost over a decade, like almost 11 or 12 years, even though we are the second biggest market, there was no conference for the penile implant so far. I just want to comrade against this battle against erectile dysfunction. I tried to do it for the past 10 years. Now, I was able to invite other surgeons and it was quite successful. I don't know how, but even one of the Saudi Arabian urology fellow came over to the conference. So, yeah, it was great. And they were also sharing their knowledge and they were also giving me questions and honest comments. And most of all, I was able to feel that we have the solidarity as a urologist who were interested in penile implant surgery. The reason why I enjoyed going to conference abroad is that I can feel solidarity in there. There are my friends who are interested in the same thing like I do. So being able to feel that kind of happiness in my own country, that's just amazing in my eyes. Yeah, so because of this success, I think we are going to have this kind of conference every year so that we can invite more urologists to talk about penile implant surgeries. Because the one and most important problem with the penile implant surgery is that nobody knows about this surgery. Surgeons get a kind of selection bias. For example, me myself is surrounded by those who know about this surgery. My colleagues know about this surgery, my patients know about this surgery, and the industry surrounds me knows about this surgery. But outside of this small pond, nobody knows about this penile implant surgery. I want more urologists interested in this surgery so that we can help more patients with this wonderful method. For the past 10 years, I was able to see a whole lot of happy patients with this wonderful method. So I just want to see more of those happy patients with the other surgeons as well. And by doing so, I think me myself will be better surgeon throughout the process. After all these processes is to make me more happy by making the others happy.